Hello everyone, I'm Dr. Ansuvan Matthew and I'm a registered pharmacist. Today I'm here to convey some information on a topic that most people are ashamed of. They don't like to talk about the symptoms and also might be reluctant to go to a doctor. And some are even afraid of having a physical examination. So I'm here to talk regarding hemorrhoids, commonly called as piles. So what are these hemorrhoids? Hemorrhoids, also known as piles, are swelling containing enlarged blood vessels found inside or around the rectum and anus. So hemorrhoids or piles are abnormal swellings of the vascular mucosal anal cushions around the anus. In many cases, hemorrhoids don't cause symptoms and some people don't even realize they have them. But when symptoms do occur, they may include bleeding after passing a stool. The blood is usually bright red. Other symptoms like itchy bottom, a lump hanging down outside of the anus, a mucus discharge after passing a stool, soreness, redness, and swelling around your anus. So these are the general symptoms that is found with hemorrhoids. The exact cause of hemorrhoids is unclear, but they are associated with increased pressure in the blood vessels in and around your anus. This pressure can cause the blood vessels in your back passage to become swollen and inflamed. Increased pressure on the anal canal can cause hemorrhoids to become enlarged. Other factors like being overweight, chronic constipation which is caused because of the lack of fiber intake, frequent diarrhea, regularly lifting heavy objects, pregnancy, and giving birth are the other risk factors to get hemorrhoids. The risk of enlarged hemorrhoids also increases with age, probably because the tissue becomes weaker over time and hemorrhoid problems are thought to run in families too. So on the basis of severity, hemorrhoids can be classified into 4 different types. Like they are classified as grade 1, grade 2, grade 3 and grade 4. In grade 1, the hemorrhoids will be slightly enlarged and they can't be seen from outside the anus. In grade 2, the hemorrhoids they are going to become larger and they are going to come out of the anus, for example like while passing stool or less commonly during other physical activities. Then they can go back inside on their own. So that is the grade 2 hemorrhoids. In grade 3, hemorrhoids come out of the anus like when you go to the toilet or do any other physical activities, but don't go back inside on their own. They have to be pushed back inside. In grade 4, hemorrhoids are like always outside the anus and can no longer be pushed back inside. So these are the types, or like based on the severity, they are classified into 4 different grades. What all measures can be taken so as to reduce the risk of hemorrhoids? Certain lifestyle changes help to reduce the strain on the blood vessels in and around the anus. So the measures include increase the amount of fiber in your diet. So by increasing the fiber content in the diet, it can help with constipation. So good sources of fibers include fruits, vegetables, whole grain rice, bread, pulses, beans, seeds, nuts and oats. Never delay going to the toilet, which means that never ignore the urge to empty your bowels. As when we ignore that urge to empty our bowels, it can make our stools harder and drier. So it can lead to straining when you go to the toilet. Drink plenty of water. Exercise regularly. This will also help to prevent constipation and also help you to lose weight. Then avoid medications which causes constipation such as painkillers which contain codeine. Adjust your position on toilet. That's also very important. For most of the human history, people defecated by squatting in the wood. Squatting with your knees against your abdomen creates a better internal alignment for the release of bowel movement. And some experts also believe that this positioning significantly reduces the likelihood of developing hemorrhoids. So try raising your feet while on the toilet, like place a low bench under your feet. This will help you for your internal alignment and also help you to pass stools faster and reduce hemorrhoids causing pressure. Sitting itself is a real problem when it comes to hemorrhoids. So, sitting for too long in even the most comfortable cushiony chairs may leave you with rectal pain and itching. However, a softer seat is preferable to a harder one, so stick a thick cushion or pillow under your rear end when sitting down on a hard chair or bench. Keep your private parts cool and dry. So, if you ever had hemorrhoids, you probably know that getting hot and sweaty between the cheeks can make your anus unbearably itchy and uncomfortable. So, choose loose fitting clothes, including undergarments made of breathable fabrics like cotton. Keeping the area clean and dry and choosing the right clothing can help to soothe your posterior pain. And also, acid bath using warm water can also help with this hemorrhoids as they help in relieving the burning or itching symptoms. These are the few measures that can be taken so as to reduce the risk of hemorrhoids. And if the condition gets worse, and like if there is excessive blood coming in the stools or excessive pain, it's very important to make an appointment with the doctor and do the further examination. So piles is something that is very common. So feel free to talk about it, and in case of any concern, do make an appointment with the doctor and do the further examination. So I hope that this information was helpful to everyone. Thank you for listening. Stay safe and stay healthy, everyone.